thing that I wanted to just focus on, Chris, in the time I have left is scope of practice. And I think what is really exciting for our profession, for your businesses and for the community is pharmacists being able to work increasingly at the top end of our scope of practice, really being able to use all of the skills, training, expertise that we have, working together with GPs, nurses, dietitians as part of a genuine multidisciplinary team, and improving patient care and overall lifting health outcomes. Pharmacists are absolutely trained and ready and experienced. And I think it's more about the systems around them recognising and remunerating them for that will really see the transformation that we need. If we are to genuinely see a transformation in health outcomes in Australia, then we need to see every person working within health, working to the top of their scope, so that we can see a real lift and improvement in health outcomes across Australia.
GPs highly value the role of community pharmacists. They are a very valued professional in the healthcare team, in the multidisciplinary team, and it's incredibly important. You know, it's always great from a GP's point of view if a patient has a regular pharmacist that they, and particularly people who are on multiple medications, so that, you know, we can call, we can, you know, check what was last dispensed, or if they've seen other doctors, what's been prescribed or dispensed to that patient, because they don't always remember. And I think it's also very important in terms of education about medication safety, about medication adherence. And I think it's also very important that general practice and pharmacy are a collaboration with complementary skill sets. I think it's very important that there is that careful delineation of scope of practice, so that GPs and patients understand what it is that the pharmacist can provide. And I think if there is an evolution of scope of practice, going back to undergraduate curricula and having a look at things like training in herbal medicines and supplements and herb drug interactions, for example, would be an important part of undergraduate, and of course also postgraduate and continuing professional development training.
You know, I think during the pandemic, pharmacy's mettle has truly been tested, and I think its value has been demonstrated not just in healthcare, but as an integral part of the social fabric of our communities. And there is a massive backlog in the UK in general practitioner appointments, and many people have been either putting it off, going to see their doctor, or you know, just haven't bothered. So creating capacity in general practice is a really big challenge for us here. So that provides an opportunity, I think, for pharmacy to play a much more integral role. I saw an audit last year, back end of last year, 1.1 million people each year are in pharmacies asking for advice. That's estimated to save around 70,000 people every week going to A&E or NHS walking centres, and about 24 million GP appointments each year saved. So there has to be much more closer working with prescribers. In the UK, we have consultation areas in all of our pharmacies, and pharmacies are capable of doing far much more than they're currently doing. So the opportunity is there, and with the eye on 2030, I think, if not now, when? So future is looking, I think, very bright for pharmacists, working as Emma described it, at, you know, the top of their scope of practice, but ensuring that there are shared care objectives with others in the healthcare team.
I think the other big trend, if I was going to think of it this way, is being truly personalized. You know, we've played this game of using data and getting information from you and tracking what you purchased to personalize some of the marketing. I think now you have independents that truly can provide personalized to the individual information. And then you, of course, you have Amazon that is coming on strong. And they are awfully good with AI, and I think with long-term care. I think they're really going to do a great job in terms of really personalizing what's going on with you. Again, if you go through sort of the very specific technologies, I'm seeing an awful lot of contactless payments, so digital wallets, curbside pickup, or pick up in any way that is the right way for a consumer. Smart shelf displays, I think, are rather interesting because it kind of bridges the gap between what's going on online and what can happen in a store. So I can get an awful lot of information that looks like I'm on an e-commerce site right there in store, recommendations, information. And then, if you kind of push it to the future, cashierless stores, right? So front of store things that I can buy and simply walk out. I think that's pushed an awful lot by Amazon, but certainly I think other stores are getting on board as well.
Pharmacy has always been a valuable and reliable, accessible source of information for patients, for the medications and any side effects or interactions that they may have. And that will always continue to be something that pharmacy needs to be accessible for. At the moment, at Bloom's The Chemist, we have a number of health checks that are screening tools for a number of medical conditions. It's our vision, though, for the future that along with dispensing the medicines and providing the valuable information, that we continue to grow these health checks. And in particular, growing things that are important to the community. It's been mentioned a number of times that mental health is an ongoing issue, and it is something that we are training our pharmacists in, have and will continue to do. And a great example that we've got at the moment where there is a need by the community and by the government for pharmacists to step up and to assist with the COVID vaccinations. Pharmacy has done so, and our vision is that we will continue to step up as the needs for the community change.
I spoke a little bit about the changing consumer and increased expectations that are coming from consumers. Well, that applies here too. So one of the massive shifts we're seeing, and it's a trend into the future, is that the vast majority of consumers now agree that a business must play a role in societal issues, on climate change, and on making the world a better place. And brand purpose is a big trend that's coming and pushing into the future, and that's a company's reason for being beyond just making money. So if you work in a business, if you own a business, you must be focused on profitability, of course, but more and more customers and employees are expecting businesses to balance profit with purpose. There are many, many research studies on this topic showing that customers are expecting a lot more from businesses. So at Bloom's The Chemist, we are focusing on our brand purpose and we are taking CSR seriously. We're considering how we can do better and play a bigger role, not just in pharmacy, but in society and for the planet. For a community pharmacy, it is our responsibility to be considerate of both the health of our people and our planet, to be sustainable in all we do, and to make a commitment to things that are really important to our customers: an ethical supply chain, diversity and inclusion, environmental and social impact. So this is something that your customers and patients are seeking now, and they'll absolutely be seeking a lot more of that as we move forward into the future.